Welcome to MedicRange. Today we are having a free webinar uh, about AKT exam. We will today discuss how to succeed in your AKT exams. First of all, let me introduce you to our team of MedicRange. I am Dr. Imran Khan. I'm the MRCGP project lead. With me is today Dr. Mohammed Ali. He's also the project lead for the MRCGP, AKT, and SEA exams. Our team is experienced GPs who are currently working as GPs as well, but they have interest in education and to help our, I would say, the trainee GPs and the qualified GPs as well to succeed in their career. Let me introduce you to other members of the team. We have Dr. Nosheen. She is our lead for the statistics, and she will be running the webinars for our statistics courses. We have Dr. Namrata. She is a very experienced GP, and she is current partner in a practice in Cheshire. And she is also a GP trainer. Dr. Katie is also an experienced GP, and she is also currently working in a practice in Northwest. We have Dr. Jazib. He is also an experienced GP and has a keen interest in education. So, how to master the AKT exam. So we're going to discuss some strategies which to help you how to succeed in the exams. Okay. So let's start with the objectives of this webinar today. Yeah. So first of all, we need to understand the AKT exam structure and the key content areas. We need to learn effective study techniques based on RCGP and NHS England recommendations. We will identify high-yield clinical topics and statistics and some guidelines. How to develop a structured revision plan. So we are going to discuss that in this webinar as well. And especially gain practical exam day strategies so that you are not anxious and worried on the exam day, which is obviously natural. So let's start with the AKT exam overview. So the AKT exam can only be given ST2 onwards in your training. The fee for the exam is around £470. Exams will be held 4 times a year, which will be in January, April, July, and October. There are some changes in the exams, and that would come in effect from October onwards. There is reduction in the questions. So the MCQs used to be around 200, but now the questions will be 160, and you will have 2 hours and 40 minutes. So that means that you will have 1 minute for each question. So you will have more time now to answer the questions. The format will remain the same. So same, you will have 80% of clinical knowledge questions, 10% evidence-based and statistics questions, and 10% organization and management questions. Let's discuss some common pitfalls and how to avoid them. As we all know, poor time management can lead to disaster in preparation. So it is important you need to know when to start preparing for the exam. So I would suggest a minimum of 3 months required for preparation, but you can always start early. As soon as or as early you start, that is obviously beneficial. It is important to have an idea how to practice the questions and time them, especially the mocks. So that will help you for your exams. Some people have lack of statistics knowledge and they find the statistics questions difficult. So if you practice statistics questions or attend some courses like RCGP, they run statistics courses. And as I mentioned earlier on, uh, MedicRange will also be running courses specifically for the statistics. Dr. Noshin will be running those webinars. Some people they do struggle with some guidelines which are very important you go through, like NICE guidelines, CKS, and BNF. So it is important you have those in hand and start revising them early as possible. Some people they are over reliance on passive learning, so they have to engage more in active recall and practice questions in order to be ready for the exams. RCGP has clearly given the curriculum, so we all need to know that curriculum and go through that curriculum in order to prepare for the exams. So if you see in this slide, clearly 26 topics in that, and if you start from allergy and immunology, cardiovascular health, children and young people, dermatology, ear, nose, throat and hearing and speech, eyes and vision, gastroenterology, genomic medicine, gynecology and breast, hematology, infectious diseases and travel health, kidney and urology, maternity and reproductive health, metabolic problems and endocrinology, mental health, musculoskeletal health, neurodevelopmental disability, neurology, older adults, people at the end of life, people with long-term conditions, including cancer, population health, respiratory health, sexual health, smoking, alcohol, and substance misuse, urgent and unscheduled care. So these are the topics we have to cover during our AKT preparation. I would now hand over to Dr. Ali, who's going to discuss and go through with you recent AKT exams, which was held in October 2024. Right, Dr. Ali, you want to introduce yourself?
Okay, thank you, Dr. Khan. That was really useful information about AKT exam. So my name is Dr. Ali. I'm a GP trainer. I work with trainees and trainers on exam strategies. So we as a team, we looked together on some of the statistics from the RCGP website, and we looked at some of the most recent exams, like the latest exam. The feedback that we have is from October last year, which is exam 53. So if you look at the range of the scores, which is from 76 to 196, you can see there's a lot of variation in there. So this was out of 200 questions. And the mean overall score was 149.42, so which is the pass mark, which is 74.71%. And you can see it is gradually creeping up as well. And if you look at the mean scores by like subject area, so clinical knowledge is 120.04, which is 75.03, and which means like 160 questions. And evidence-based practice, which is 14.14, which is 70.68, and these are 20 questions. and organization and management, which is 15.24, which is 76.21%, which is which is in 20 questions. And you can see the clinical knowledge still has the massive part of the examination. If you look at the statistics and looking at the pass rate of all the candidates, so there were 1,529 candidates who appeared in the exam, in October exam, and the pass mark was 145, and the pass rate was 62.52%. And then if you look at the UK graduates, the first time takers, then there were 450 candidates, and the pass rate was 84.20%. This means there is some massive difference in UK graduates versus international medical graduates, and that has led to decrease in the overall pass rate to 62.52%. So other key statistics like reliability, which is 0.91%, and then standard error of measurement, which is 5.7, which is 2.86%. Thank you. And these are some of the summary of the areas or the feedback from the exam. And these are the areas which was identified by the examiners. These included prescribing in older adults, interpretation of results, colorectal and perineal conditions, hormone replacement therapy, common musculoskeletal conditions, common neurological conditions, pediatric adult asthma management. So these are quite commonly tested areas in the exam, and also we see these areas in the common practice quite a lot. And if you look at the past 12 months from AKT exam number 51 to exam number 53, so after each of the last 3 sittings of the AKT exam, so these were the areas which was highlighted by the RCGP, for example, like neurology. And then we looked at the area, 2 of the last 3 sittings of the AKT. These were areas were highlighted, which include improving quality, safety, and prescribing, leadership and management, children and young people. So we have a team in MedicRange. We have developed some strategies to help overcome these areas. So first of all, so there are some strategies which we strongly encourage. For example, like active recall. So which means like use of question banks. So our question bank at MedicRange is robustly made and is usually very up to date as well. And we usually take the guidance from the RCGP to create these questions. And then other question banks like GP self-tests on RCGP is pretty useful as well. And then if you look at the other strategies like spaced repetition, so it is really important to repeat what you have learned as well, and to test it. For example, if you have read something, it's really important that it is repeated at certain time. So it's important to schedule like reviews tools like a flashcards, which is called like Anki. And then there's like a peer learning. So it is important to discuss with other colleagues, other candidates, and like in small study groups, and to carry on discussions. And other things like guidelines, it's important to be aware of the latest guidance as well, like for example, NICE guidance, CKS, GMC, or BNF. So these are some of the high yield topics which we looked at RCGP and NHS England guidance. And so these are like cardiovascular, so which include hypertension, heart failure, atrial fibrillation, then respiratory, COPD, asthma, a huge chunk in the general practice, and then endocrinology like diabetes, thyroid disorders. And then menopause and contraception and pregnancy guidelines, all the women's health related stuff. And then we look at the mental health side of things, then depression, anxiety, and safeguarding is really important. So these are the common, very high yield areas. And then one of the area which in which a lot of candidates struggle is the evidence and statistics. So we, as a MedicRange, have created live webinars for evidence-based medicine, which is run by Dr. Noshin. So, and she has like a vast experience of dealing with all these topics. And some of the key concepts which we usually encourage is to look at like some key concepts like sensitivity, specificity, number needed to treat, number needed to harm. So these are really, really key concepts. And then looking at some data interpretation, graphs, research papers. And then some like recommended resources by, like, for example, RCGP, AKT statistics, or NB update, or MedicRange course. So we recommend all these courses as a team. So looking at some of the exam day strategies, so time management is key. So there are like 160 questions and 160 minutes, which is going to be from October onwards. So this used to be like 57 seconds for each question previously. So the ratio of the time versus question has improved, but still it's still quite a limited time. So make sure. So and this could be mastered by using a lot of mocks, which we have provided on MedicRange as well. So you can do a lot of mocks and MedicRange, and also making sure to flag the difficult questions. And so this is to this is to make sure that the questions are attempted by doing an educated guess. And like managing stress, this is really important before the exam and during the exam, like using some activities like deep breathing, some resting before the exam, and some positive thinking about so what we're going to do after the exams or before the exam. So this is all really, really useful. So if you look at the last 2 weeks, so as in the MedicRange, so we created this philosophy about this 2 week wait high yield provision. In this, like we encourage people to focus on the weaker areas identified through the mock exams, and then looking at daily review of the guidelines. For example, if you're seeing patients, you make sure you look on the CKS NICE guidelines, you look at BNF, and you look at various cancer pathways. And then practice as much question as possible. So, and this is like a test for what knowledge that you have gained during the revision or during seeing patients. And then in the final week, so consider attempting like a full length mock exam, maybe timed exam, so might be useful. And also, if you have made some notes, maybe just go through those notes as well. Okay, so some final tips and resources. So for example, Ask the GP learning resources, e-learning, and some past papers like on the AKT feedback. And then some question banks like GP self-test, 14 Fish, and MedicRange. And then podcasts like Primary Care Knowledge Boost, NB Update, they are really useful. And then some online courses like RCGP or MedicRange courses. Yeah, can go to the next one. Okay, so to summarize what we have discussed today, so some takeaway from this one. So the first thing is like to understand the AKT structure. So for example, there are like 160 questions, there are 160 minutes. So making sure to cover all the clinical knowledge, statistics, and management area. Number two, avoid common pitfalls. For example, manage time effectively, strengthen statistics knowledge, and actively engage with guidelines. And number three, use proven study strategies. For example, active recall, spaced repetition, peer learning, guidelines, focused revision. And number four, focus on high yield topics. For example, as I mentioned, cardiovascular, respiratory, endocrinology, women's health, and mental health. And then master the evidence and statistics and learn these keys areas like specificity, sensitivity, NNT. These are all very, very key areas in these. And then adopt an exam day strategies. For example, practice time questions, flag difficult ones, and manage stress effectively. And then follow a 2 week revision plan as we identified here. So identify the weaker areas, review the guidelines, practice about 100 questions a day in the last 2 weeks of the exam, and take full length mocks. And then finally, utilize some key resources, for example, RCGP e-learning, question banks like MedicRange, Primary Care Knowledge Boost, and some online courses. Okay, I will leave the floor for some, if any questions. I can see there's a question here, so which is commonly asked. It's about how should I prioritize topics during revision? So my answer is like focus on the high yield topics first, so like cardiovascular, respiratory, endocrinology, women's health, and mental health. And like use the RCGP curriculum guide and past AKT reports to identify commonly tested areas. And if short on time, prioritize weaker areas based on the mock exams and self-assessment. And there's another question that generally come through as well. So what is the best way to improve my statistics knowledge for the AKT? So my answer would be, as an educator, is to start with the basics first, like knowing the sensitivity, specificity, and number need to treat, how to interpret a research paper, and use some RCGP statistics modules and courses like MedicRange. And practice interpreting research papers and summary statistics from NICE and BJGP. And try some exam style questions regularly to improve the confidence. And So there's another question that's generally asked is about like how someone balances working in GP practice with AKT revision. So the answer is like use some like clinical encounters as revision opportunities. So look up relevant guidelines daily, keep a learning journal of cases that challenge you. So set some like a realistic goals, for example, like a 30 minutes of questions practice every day. And then block out dedicated study time each week, especially closer to the exam. And some other question like how many questions should I be doing daily to pass the exam? We say in the last 2 weeks, ideally as much question as possible, for example, 100 questions as a guide in the final month, and aim for a mix of like untimed, timed, and full mock length exams. And focus on understanding why you got a question wrong rather than just answering more.
Thanks,
And
Doctor. And also, it is important to go through the DVLA guidelines and the guidelines for the sick notes. So you can always discuss that with your trainers. And but also the information is available on the RCGP website and DVLA website as well. So you can always go through those websites and get the information. Yeah.
Yeah, okay, yeah, thank you so much. Yeah, so if any questions, you can contact us through the email or on the phone, or go to our website and submit like a query form. So we are more than happy to help you out. Thank you so much.
We also have, obviously, we've told you our website is medicrange.com, and we run variety of courses. So we have the question bank for the AKT exams. So we also have the mock exams in that question banks. So there are various packages which we are offering for our candidates. So if you go to the website, you will find all those packages which are for the AKT exams, also for the SCA exams, and also, as I mentioned, in the future, we will be also running some CPD conferences as well. So there are loads coming. So you just need to be obviously visiting our website. And if you have, as Dr. Ali mentioned, if you have any questions, any queries, just drop us an email or give us a call or on our WhatsApp number. So we are always here to help. Many thanks for joining this webinar, and see you soon for our next webinar. Thank you. Bye.
All right, thank you so much. Thank you.